Mouth Care Comatose Resident. In this skill, we're providing mouth care for a resident who is unconscious. These residents require more frequent oral care. For the purpose of this skill, you'll be using toothettes instead of toothbrushes and toothpaste because these residents cannot swallow. In saying that, we want to prevent aspiration. So the most important thing on this skill is to make sure that we have the head of the bed elevated at least 45 degrees with their head turned well to one side, or you can turn your resident completely on their side to perform the mouth care. Make sure that you brush all surfaces with the toothet. That's upper, lower, inner, outer, chewing surfaces, their tongue, and their gums. Good morning, Ms. Robinson. It's Katrina, your CNA. I'm here to do your mouth care, okay? I'm going to wash my hands and provide some privacy before I begin. You still want to talk to your resident even if they are comatose. Okay, for the purpose of this skill, you're going to need a barrier for your bedside table. You'll also need a towel to put under your resident's head, an emesis basin, 2 toothettes. We don't use toothbrushes for the comatose patient, and also a cup of water. So now I'm going to prepare my area before I start the mouth care. Remember, on anything that is oral care or dealing with the perineal area, we only put the gloves on right before we start the care. Since my resident is comatose, I'm going to have to position her so that we can prevent aspiration. First, I'll lift the bed to working height, which is somewhere between mid-thigh and waist level. I'm also going to raise her head to 30 to 45 degree angle. Now I'm going to put a towel on this side of her because I need to turn her head this way in order to do her mouth care. I'm going to gently turn her head this way. Now that I'm ready to begin, I can put my gloves on. Okay, we're going to start with the first toothet. I'm going to dip it in the water, and we're going to get the excess water off along the edge of the cup, because we don't want too much liquid in the mouth of a person who cannot swallow. Now we can begin our mouth care. We gently open the mouth. You may meet some resistance in a comatose patient, but be gentle and open the mouth so that you can get to her teeth. Okay, so now we're going to start with the lower. Let's start with the lower, and we're cleaning the chewing surfaces, inner and outer, including the gums. Okay? I'm going to place that in the emesis basin now because it's dirty. Now we're going to go with the second toothet to do the upper. Dip it and get off the excess water. These toothets already have cleaning solution on them. So now we're going to do the top, making sure we get the gums. We're going to do the inner on the top and the chewing surfaces. Now we're going to do her tongue. We're going to get to the tongue as best as we can without causing aspiration. Okay, now we're done. Now our comatose patients, they can't swallow and they can't spit, so we're just going to clean her mouth for her. Okay? Now I'm going to return her head to the position it was in. And I'm going to let the head of the bed down. I'm also going to lower the bed to the lowest position for safety. Now that I'm done with her oral care, I'm going to get rid of my supplies. All of my disposables are going to go into the garbage. So we're going to throw away the disposable stuff. Our linen goes into the linen hamper. We're going to wash, rinse, and dry our emesis basin. Now we can return this to storage. After you've returned your equipment, you can now take your gloves off. So now that I'm done with the resident's oral care, I'm going to pull the curtain back. We still provide the call light for our comatose residents. I'm washing my hands and I'm done.